Let's begin with the next family, and that is the Vibrio. We all know that Vibrio is divided, although we are most important one is Vibrio cholera. But before I get on to the cholera aspect, I think I would want to tell you that Vibrio is divided into two families. The ones which are salt loving, known as halophilic, and the ones which are non-salt loving and cannot grow on salt. And actually you would realize Vibrio cholera and Mimicus comes under this. All the others like parahemolyticus, alginolyticus, vulnificus, they are all salt loving. So all these us, that is parahemolyticus, alginolyticus, vulnificus, they are in love with salt. They need 7 to 10% of salt. Cholera and Mimicus do not need salt. So remember, cholera has two different types of strains that are circulating. We have classical and we have L-tor. And the method of learning this is L-tor is everything. L-tor is going to be everything resistant. So if I ask you, what is the polymyxin B sensitivity? You will say it is resistant. Phage for susceptibility, it is going to be resistant. Versus if I ask you any test, everything is coming positive, positive, positive. Beta hemolysis, yes. Chick erythrocyte agglutination, yes. VP test, again, yes. Whereas classical is everything sensitive and negative. Bilkul opposite. Sensitive and negative. So simple. L-tor yaad kar lo. L-tor is the one that is everything resistant and everything positive. Also, please remember that what are the carriers going to carry? Carriers for Vibrio cholera carry the L-tor strain. Okay, this is your basic. Before I start off with Vibrio cholera, I think all of you know what is the disease that it causes. So, agar patient ka diagnosis banana hai, so first you will say that let's talk about the clinical history. Clinically, these patients land up with the very, very famous rice water stools, right? Rice water flaky stools, and rice water diarrhea is what is there. But how does rice water diarrhea happen? Because of an increase in which mediated pathway? Cyclic AMP. So now you would want to know that what are all the conditions that increase cyclic AMP. We'll have a mnemonic for that so that I don't have to repeat it again and again. Hai na? So cyclic AMP ka mnemonic is cyclic AMP only. How convenient. So what is the C? Obviously the C means cholera increases cyclic AMP. What is A? If you remember, in case of anthrax, Bacillus anthracis was also increasing cyclic AMP. M ko, I'm going to turn it a little and make it E, because please remember, enterotoxigenic E. coli. Toxigenic E. coli was causing what? Traveler's diarrhea. That also increases cyclic AMP, and that is which toxin? The labile toxin. Because you will say that, ma'am, you didn't teach us over there. In the rapid revision, you have not taught us. Labile toxin, matlab, there must have been a stable toxin also. Yes, I will come to that, but abhi ke liye remember labile toxin. And P for pertussis, whooping cough. So remember, guys, please note cholera, anthrax, E. coli, enterotoxigenic E. coli and pertussis, because now I will tell you the next part of this mnemonic. तो क्या करा था? Cyclic AMP में बस M को turn कर देना, तो CAEP is your mnemonic over here. So now we need to know the difference between cyclic AMP versus cyclic GMP. So please remember, in E. coli, enterotoxigenic E. coli for example, we will learn it, and I had told you one mnemonic that it is going to be labile in the air. When someone is very labile, he is going to be flying in the air, and when someone is very stable, he is going to be stable on the ground, hai na? So remember that cyclic AMP agar bola hai, so which toxin is there? It is the labile toxin. And if cyclic GMP is written, then which toxin is there? It is the stable toxin. That is the first difference between AMP, GMP you have to know. First is, next one that you have to know is, you must have heard, and I have taught you in Bacillus cereus, that there are two types of food poisonings that it causes. The number one food poisoning is going to be the one which is diarrheal, in which patient has diarrhea, and the other one is the one in which there is emesis, there is vomiting. So remember that diarrhea goes out from the anal canal. Diarrhea is going to go out from the anal canal. This means cyclic AMP is elevated in it. Whereas emesis, vomiting, is going to happen from the gala. Gala basically means that cyclic GMP is going to be mediated in it. These are the two differences between AMP, GMP you have to know. So for E. coli, please remember, labile in the air and stable on the ground. And for Bacillus cereus, please remember, diarrhea through the anal canal and vomiting is going to happen from the gala. That wraps up. Coming back, why did I teach you? Because cyclic AMP, C for cholera. So how are you going to do the diagnosis? Firstly, whatever stool sample that you have, you're going to put it in a transport media. There is a VR media, which is a transport media, and also a Carey-Blair media, which is used. Venkatraman Ramakrishnan medium and Carey-Blair medium, ये दो scientist वाले are the transport media. What are the culture media? There's a famous culture media called TCBS. I'll actually show you the picture straight away. Have a look at this. When you're talking about Vibrio, you must be noticing that Vibrio is going to be what? It is going to be a comma-shaped organism. And now that you've told me this, tell me the motility also. Motility mein kya aata hai? It's the very, very famous darting or the shooting star motility. Darting or the shooting star motility. And this is also shown, other than Vibrio, who else shows it? It is also shown by Campylobacter. So that is the darting or shooting star motility. Okay, so comma-shaped organism, and you can see that yes, beautiful comma-shaped organism that I can notice over here. Now, what is the media? I told you I grow it on a TCBS. I hope you remember the full form of TCBS. It is thiosulfate. Just quickly you go through it once. Thiosulfate citrate, bile salt, sucrose. Bile salt, sucrose. Basically it tells me of sucrose fermentation. So guys, when sucrose is fermented, what is the color that you get? You get a yellow color. Color change ho raha hai. So ma'am, they will ask me what is the indicator? Bromothymol blue is going to be the indicator. That's again a very, very important question that you have. Bromothymol blue is the indicator. So repeating all this once again, if you go to the culture media, I have given you now a list that all the fermentations are gonna give you a yellow color, but which was the only fermentation which gives you a pink color? That was McConkey. We've done that summary table also. So coming back, please remember Vibrio cholera is gonna be a sucrose fermenter. Vibrio parahemolyticus is a non-sucrose fermenter, because I don't see any yellow color over here, and that is the sucrose fermentation that I did. What will I do on get on a gelatin stab? So please note that you can't consume rice alone. Rice के साथ कुछ vegetable needed है. So which kind of liquefaction do you notice? You see a turnip or a napiform liquefaction. You see a turnip or a napiform liquefaction that you see. So simple. For rice, you also need a vegetable. And now you'll say, ma'am, you are having rice, you are having vegetable, but did you pay for the bill? Exactly. If you want to eat rice and if you want to eat vegetables, where are the coins? Where is the money? So Vibrio is going to be coins positive. That is your mnemonic. For the rice and for the turnip, give the money. Number one, cholera red reaction is positive. What is the red color because of? There is a compound form called nitroso-indole compound. Previous year question. Red color of cholera red is because of nitroso-indole compound. Next, it is catalase positive. It is also oxidase positive. IN for it is indole positive. N alone for nitrate reduction positive. S for sucrose lysis and S for string test. ठीक है, तो जल्दी से cholera red, catalase, oxidase, indole, nitrate reduction, sucrose lysis, string test. It is Cohen's test positive, and that is the string test that you have in front of you. Now, there are a couple of things that I want to discuss with all of you over here, and one of them being that this cholera you just said is oxidase positive. So can you now tell me a list of everything that is oxidase positive? Correct. Like you said over here, V is going to be for Vibrio cholera. Similarly, now in a while I will be teaching you an organism called Pseudomonas, and that is also going to be oxidase positive. What I have already taught you earlier is Neisseria. Neisseria is also oxidase positive, and in the end I will teach you two bacters. One is a Campylobacter and the other one is going to be a Helicobacter. These are all oxidase positive. So instead of learning punch, we have learned P वंश वाला. ठीक है. So now remember, urease के लिए the mnemonic was punch kiss. अब देखो mnemonic का भी mnemonic we will have to do. For urease, it is punch kiss, whereas for oxidase, it is the same punch, but the punch is a spelling change with a V. You don't have to get confused over here. So yes, Vibrio is going to be oxidase positive because it's a mnemonic of the punch V wala punch that you have, right? Lastly, what is this string test? So as I told you, string test is that the rice water stools are now going to become stringy. So please note, where all can you see a string test? And there are three places where you have to make a summary of it. Number one, the string test is seen with Vibrio cholera. Sometime back I told you there was a stringiness that was also seen with the mucoid colony of Klebsiella. And is there a string test that you do in a patient in case of parasitology? Yes, string test is also for Giardia lamblia, again something 3-way string test is going to be very characteristic for you. Let's move forward, guys. These were all the Vibrio choleraca features, but what about the salt-loving organisms? Parahemolyticus, Vulnificus, and Alginolyticus. What about these? So please note algino. Algino we had learned like Chinese food has salt, a lot of salt, high salt content. So which is the most tolerant to salt? Ma'am, Ajinomoto. Ajinomoto hota hai Chinese food mein, and that makes it very, very salty. So this Ajinomoto wala, that is Alginolyticus, is going to be very, very tolerant to salt. Then earlier I had told you which of them shows swarming. Remember there was a mnemonic called PVCs, and I told you PVCs mein Vibrio parahemolyticus and Alginolyticus are gonna show you swarming. That is a question that I had put up for all of you. Both of them tend to show you swarming, the parahemolyticus and the alginolyticus. So now kya karte hain? See, one thing is there that all of them have a common finding. All of them cause wound infection. So you will say, okay, ma'am, that wound is, we heard a muhavra na, jale pe namak. So jale pe namak, halophilic. These are salt loving, na? So they are salt loving, so the wound also has to come. All of them have wound infection. Parahemolyticus causes gastroenteritis. Vulnificus can cause sepsis, and Alginolyticus, it is Chinese food, na? So Chinese food, I told you, is very, very salty. Ajinomoto, most tolerant to salt. Chinese food is very, very spicy. So spicy कि कानों में से और आंखों में से धुआं निकलेगा. So these patients are gonna have conjunctivitis and otitis media. So spicy Chinese food, कानों में से आंखों में से धुआं, and very, very salty. So very, very salty and very, very spicy is how I have learnt it. Next, which out of these can show you the Kanagawa phenomena, and that is the parahemolyticus. What is Kanagawa phenomenon gonna be? So for Kanagawa phenomena, if you remember, we were using the Vagatsuma agar. Vagatsuma agar is nothing but a blood agar, and because, ma'am, these are very, very salt loving, so thoda sa salt dal do, 2 to 4% salt you put for this fellow over here. So you put a blood agar. Now tell me, hemolyticus, you are trying to see blood agar pe kya, whether it is breaking the blood or not. So you will say that if there is hemolysis, if hemolysis is present, this means that strain is working, it is pathogenic, and hemolysis is not seen, this means it is non-pathogenic. That is known as Kanagawa phenomena. Repeating, what is Kanagawa phenomena? You take a blood agar, if it breaks it, it is pathogenic. If it doesn't break it, it is non-pathogenic. What is that agar? Known as Vagatsuma agar, and that is hemolyticus will only show you this hemolyticus wala feature, right? So simple. This is the story of the salt-loving wala Vulnificus, Alginolyticus, parahemolyticus. Most expected question. Question 1, most tolerant to salt. Ajinomoto, Alginolyticus. Kano और आंखों में से धुआं, very spicy Chinese food. Conjunctivitis, otitis media are a feature of what? Alginolyticus. Super favorite questions. Now we've done with the Vibrio family, so we move on to the next one, and that is the family of the non-fermenters. What does that include? So non-fermenters matlab they are not going to use sugars fermentatively. They will use them oxidatively, not fermentatively. So remember Pseudomonas, Burkholderia ka species, and Acinetobacter baumannii. So remember non-fermenters. I think when I say Pseudomonas, it's very clear that the color coming to your mind is this blue-green color pigment called pyocyanin. What do you have to know? It is a diffusible. Till now, whatever pigments I taught you were non-diffusible. This is diffusible, means everything is gonna turn blue-green. It's going to diffuse out everywhere. And please remember, this can basically be enhanced on a media further, that is known as King's media. So king में तो मतलब in a king's rule everything is going to be magnificent ना, king के लिए सब कुछ out is going to be very extravagant. So remember, for the king's media the color is going to be more, it is enhanced on a king's media. What are the other colors that this can produce? It can produce a greenish yellow color also, that is pyoverdin. It can also produce a rubin matlab red color. It can produce a blackish matlab melanin, pyomelanin. All these pigments are possible, but pyocyanin, which is blue-green, is very, very famous. Not only this, all the diseases are also going to be blue-green. So very commonly asked is this green nail syndrome, very common. Next, wherever it will cause an infection, wahan green color lagana, blue-green color. So if it says UTI, urine ka color, blue-green. Meningitis, CSF color, blue-green. Burn wounds, you know Pseudomonas is associated with burn wounds infections. Of course, you know it. Okay, next we come to, it can cause contact lens associated corneal ulcers. It can cause pneumonia. Pneumonia matlab sputum ka color blue-green. These names, please learn these fancy names. Swimmer's ears, which is otitis externa. I hope you remember. Then you have hot tub folliculitis, and hot tub folliculitis is also known as the jacuzzi's fever. So because this happens when people taking bath in jacuzzis, then spas. So remember hot tub folliculitis and Shanghai fever. Overall realize ये pseudomonas का king वाला जो है ना, ये king के साथ काफी fancy it has become used to very rich lifestyle. So it is roaming around in Shanghai, it is taking bath in jacuzzi and hot tubs, and it is also swimming and chilling in life. So swimmers here, the king's media wala is enjoying the king, living life king size. So Shanghai fever with the swimmer's ears, with jacuzzi, hot tub folliculitis, and most expected question, green nail syndrome. So I've got you a mnemonic which I taught you in the main lectures, and I think that's the best mnemonic for pseudomonas possible. So सबसे पहले P is pigments. Have I told you pyocyanin, rubin, melanin, verdin, all of them are enhanced on which media? King's media. S for what? This tends to create a sweet or a sweety, fruity odor. Okay, tell me, whenever you will grow it on any media, you know there is E for iridescence. Iridescence मतलब ऐसा shine होगा. There is a metallic shine that occurs. And what media am I talking about? I'm talking about a selective media. Which selective media? For Pseudomonas, the selective media is cetrimide agar. Next, tell me, how does it utilize sugars? Ma'am, non-fermenters हैं ये. They will utilize sugars oxidatively. What is MO? They are motile. Only for adding something. We know they are non-lactose fermenters. Are they on agar? Blood agar going to show you beta hemolysis? Yes. And selective media is cetrimide agar. So jaldi se pigment hai, sweet fruity odor hai. There is iridescence which is going to be a shine. Which selective agar? That is going to be cetrimide. Blood agar pe it is a hemolytic organism. Uses sugars oxidatively. MO for motile and N for non-lactose fermenters. This is the story of Pseudomonas. I hope you also know Pseudomonas has been included in the WHO priority list for nosocomial infections acquired from the hospital. So nosocomial infections which are having multi-drug resistant WHO organisms, कौन से हैं? Escape. They are gonna escape the antibiotics. They are gonna be drug resistant. They are gonna basically be having problem in the hospital, nosocomial infection. So E for what you read in the cocci, Enterococcus fecalis. S for Staph aureus. तो ये दोनों cocci में आ गए. आगे देखो, Klebsiella pneumonia, which is very commonly seen in hospitals. Acinetobacter baumannii, which is a part of non-fermenters. Pseudomonas is also a part of non-fermenters. And Enterobacteriaceae ka species. So firstly, if I talk about the cocci, Enterococcus and Staphylococcus, then all the other come under bacilli. So Enterobacter, Pseudomonas and Acinetobacter, तो same non-fermenters का family है. And finally, we have the Klebsiella. So yes, these are all the WHO priority list of nosocomial infections having MDR. So Pseudomonas is done, right? I've also told you Acinetobacter comes under escape organisms. Now we are left with Burkholderia. There are three Burkholderia that you have to know. Burkholderia malai, Burkholderia pseudomalai and Cepacia. Easy wala khatam kar dete hain. That is Burkholderia, Cepacia. Alternate alphabets you will take up. So if I ask you which is the most commonly found out of them, that is Burkholderia, Cepacia. Also, if I ask you which is the most potent out of these, that is going to be Burkholderia, Cepacia. If I say which is also antibiotic resistant, is again this organism. And if I finally say the most important question, which is associated with chronic granulomatous disease and cystic fibrosis, that is also Cepacia. So I told you, take up alternate alphabets. Most common, most potent, associated with cystic fibrosis and chronic granulomatous disease, and it is going to be antibiotic resistance. That is Burkholderia, Cepacia. Now we come to Burkholderia malai. So up confusion, always students have a confusion, malai and pseudomalai, because one is in humans and one is in animals. So I have learned Burkholderia malai is going to be Burkholderia animali. Okay, so that is how you will be learning it from today onwards. It is going to be Burkholderia animali. So you will know that, oh, this is the one that is happening in animals. This is the one that is seen in animals, and in animals it is known as Glander's disease. Ma'am, Glander's disease matlab kuch glands honge, lymph nodes honge, lung infections, skin ulcers. Yes, all are the clinical features. So this is the one that you see in animals known as Glander's disease. And how do you do the diagnosis? Wo bhi animals. There is a diagnosis done by something called Strauss test. Stross test means if you if you inject this organism in a guinea pig, there is going to be testicular swelling that is going to be seen. So simple. The disease also happens in animals, and the diagnosis is also made by an animal test called Stross test. So I have learned Stross for scrotal. Scrotal inflammation hoga. Scrotum matlab testicular inflammation hoga. Stross for scrotum. This is animali. Disease also animals, diagnosis also animals. Because now when I come to pseudomeli, that is the one that you see in humans. The same ulcers and the pneumonia and everything now in humans. So please note, this is known as melioidosis, and why in humans this happened during the Vietnam time bomb. With that bomb blast, all the soldiers in that area in Vietnam ended up having the disease. So this is known as the Vietnam time bomb or Whitmore bacillus. Vietnam time bomb, and Whitmore bacillus, that is the one that is going to be showing you this condition. So imagine if there is a time bomb, you will say, ma'am, time bomb, matlab if bomb blast hua, to everything will come down to ashes. If you ask me what is going to be the culture media, it is the ash down agar. It is going to be the ash down agar, because bomb blast ke saath everything comes down to ashes. Versus if you ask me that what is the microscopic appearance, that I've already told you, safety pin. I'll give you one more story. From a bomb blast, you of course need safety. So bomb blast ke saath safety chahiye, and that is what you're going to see over here. And finally, if I say what is the treatment, the carbapenem, imipenem, these are the treatments that you have. And is this sounding quite dangerous? Yes, Vietnam time bomb. Is this associated with bioterrorism? Of course. So always remember, pseudomeli is the Vietnam time bomb. Time bomb will come down to ashes, ash down agar. You need safety against a bomb blast, safety pin appearance, and this is going to be treated by carbapenem, imipenem, and it's quite deadly. So bioterrorism. Whereas pseudomeli was in humans, malai, only malai bola, to ma'am ye animali wala disease.